Speaking of aging, at 9:50, we want to talk about Alzheimer's. It's a disease that is now expected to affect nearly 40% of Blacks and Latinos in the U.S. by 2030. That's just 4 years from now. Yet it remains one of the most under-discussed health crises in communities of color. So to help us understand this is dementia care expert, nurse, and researcher, Dr. Fayron Epps, who joins us now. Dr. Epps, thanks for joining us.
Thank you for having me.
Those numbers are quite alarming. What do you attribute this to?
Yeah, they are alarming, and we're not having these conversations, as Black Americans are twice more likely than their white counterparts. Latino families are 1.5 times more likely. And one of the things is a lot of the information is not getting into these communities. They also don't have access to resources and supportive programming. So it's so important. We at Alzheimer's in Color, we are trying to make sure that they get the information that they need so they can have these honest conversations, and we can start really getting the help sooner and change the narrative and change these statistics.
Yeah, is there a cultural component to it as well that sort of drives a little bit of the silence? They don't discuss this at the dinner table?
Yes, so there's stigma all around, but especially in our communities of color, this is just something that we have not been educated on, and we don't have these conversations. And many times, whatever happens in a household, it stays in the household, and we don't go out and share. And that's why storytelling is so important, that in Alls in Color, we're making sure that we share our stories so we can change these narratives.
Yeah, tell us about this program, ALTER, and only nurse-led dementia-friendly program, right?
Yeah, ALTER is where we partner with Black faith communities to equip them with the resources so they can be dementia-friendly faith spaces. And we are a supporting partner with Alls in Color, which is a campaign focused on brain health conversations in Black and Latino communities.
And what specifically do you do to reach out to these communities?
Yes, and so on our website is where we have a lot of the resources, webinars. We are empowering communities with authentic storytelling, and so we're making sure we have individuals, families share testimonies, and we welcome more families to share testimonies. As I mentioned, when we can talk about this and share, we can help more people.
Why does it matter that you've dedicated so much of your life and your career and your passion to, culturally tailored programs and getting these stories out? Why is this important to you?
It is so important because many times we don't get the resources, or we're not doing things that can help our community. But when you can see resources that respond specifically to the needs that you have within your family and community, you can start taking action, and that's what it's really about. We have to change these statistics. You mentioned how they are alarming. We need to do something about that, and we need to take action. And so promoting brain health in our communities and having these conversations around brain health is so important.
When families watch a loved one with something happening at home, a warning sign, a red flag, something that seems off, for families that don't talk about this, right, what do you tell them? What's the first step?
Yeah, so when you see this, we encourage them, try to share with another family member. If you're not comfortable sharing it with your family, when you go to your healthcare provider, share with them what you're seeing. One of the things is it's just not about forgetting and misplacing things. It's also could be drastic personality changes. It can be not being able to complete a familiar basic task. Those are things that we need to bring up and share with our family, and or share with the healthcare provider so we can start getting help.
And when it comes to families of color, Black, Latinos, what is something you want them to know that a lot of people don't know about Alzheimer's or dementia?
Yeah, so what I want them to know that it is actually happening in our community, and this is a public health crisis. So we cannot just sit on this and continue to be silent. We no longer can be silent as a community, as a people. We have to discuss this, have these conversations, bring this home, have these conversations over dinner so we can get the help that we need.
Yeah, I mean, 4 years from now, 40% of Blacks and Latinos to be diagnosed with Alzheimer's. That is just unimaginable. What can people do today, Dr. Epps? How to get involved and get more information?
Yes, so if you want to get involved, please visit our website, allsincolor.com, and you can get more resources, get education at your fingertips, and we are here to help you.
Dr. Fayron Epps, appreciate your time this morning and the initiative that you're taking, being proactive in trying to break the stigma of Alzheimer's in our Black and Latino communities. Appreciate that.
Thank you.